I actually don't know how to enlarge my screen. I want to maybe see if I can get larger.
All right. Hi, I'll be your nurse practitioner today. My name is Rachel. Tell me what brings you in today.
Hi, Rachel. My name is Esther. Um, I have been having problem lately. I noticed a lot of bleeding in my body. I've been having nosebleeds, blood in my urine, and blood in my stool. And I'm worried because I'm also pregnant, and I have a family history of hemophilia.
Okay, I understand your concerns. We can perform genetic and chromosomal screening tests. And in order to diagnose hemophilia A, the bleeding time and PT are normal, but the PTT and APTT and coagulation time are prolonged. The serum level for factor VIII will be low, and it is important to take all precautions with patients who do have hemophilia, especially undergoing invasive procedures. There are some common signs and symptoms that can include like bleeding into the joints, and that can cause swelling and pain and tightness in the joints. Bruising of the skin can happen pretty easily.
Okay. I don't really know much about hemophilia. Can you tell me more about hemophilia?
Sure, of course. The hemophilia is usually an inherited bleeding disorder in which the blood does not clot properly. The blood contains many proteins that are called clotting factors that help stop bleeding. This abnormality or deficient of clotting factor can lead to spontaneous bleeding, especially following injuries or surgery. People who are affected by hemophilia are low levels of either factor 8 or 9. The mutation or alteration causes hemophilia in one of the genes. These genes provide for the instructions for making the clotting factor protein to form a blood clot, and they are located on the X chromosome.
Oh, okay, that's a great information. Are there any complications that I need to be aware of?
There are some complications like bleeding in the neck, joint damage, and bleeding in the brain.
Okay, that's good. What are the treatments? Are there treatment options for hemophilia? And I would like to know the treatments too.
Yes, there are treatment options. There's replacement therapy, desmopressin, DDAVP, and antifibrinolytic drugs that can be used to help treat hemophilia.
Okay, cool. I'm worried because I think I might be at risk of miscarriage. Would I be at risk of miscarrying my baby?
Not necessarily. If we can do things to help reduce the risk factors for miscarriage, in order to do that by using the factor replacement therapy.
Okay. Again, will I be at risk of bleeding through my pregnancy?
Will you be at risk for bleeding during your pregnancy? Actually, it will actually be less bleeding than it would normally. And this is because of high levels of hormones during pregnancy that stimulate the production of blood clotting protein. And in order to prevent bleeding, there are a few things that we should think about avoiding: an epidural, suction, extraction of the baby, deep IM injections, and unnecessary episiotomy.
Okay. Will it be okay to breastfeed the baby?
Yes, it'll be okay. The high levels of hormones will continue when you breastfeed, so that'll actually help with the bleeding.
Okay. What if my baby has hemophilia?
If we think your baby might have hemophilia, we can arrange to have a sample of the cord blood tested at birth and request that the vitamin K shot be given by mouth instead of injection.
Okay. What are some signs and symptoms I can look out for in case the baby has hemophilia?
So some signs and symptoms we can look at to make sure we can catch it early is bruising and bleeding of the gums, especially when the baby starts teething, frequent bumps and bruises when the baby's learning to walk, swelling of the joints, muscle, and soft tissue.
Okay.
you want to go ahead and start on yours?
Okay. Now on the MP. Hi, my name is Esther. I'm gonna be your nurse, your MP today. Tell me what brings you in here today.
Hi, my name is Rachel. I've been having some problems lately, and I've been noticing frequent and unexplained nosebleeds, bloody urine, and bloody stool. I'm worried because I'm pregnant, and I do have a family history of hemophilia.
Oh, okay. The common signs and symptoms of hemophilia can include, but not limited to, bleeding in the joints, bruising, epistaxis, that is bleeding through the nose, and the loss of a tooth can cause excessive bleeding, or little injuries can make you bleed more than usual.
I don't know much about hemophilia. Would you mind telling me more about it?
Yes, of course. Hemophilia is usually an X-linked inherited disease. It's a bleeding disorder in which the blood does not clot properly. The blood contains many proteins that are called clotting factors, especially factor 8, factor 9, and these clotting factors are deficient or at low level in people with hemophilia. So if they test your blood, it's gonna be deficient or absent. That means you have hemophilia.
Okay, well, thank you. Are there any complications that I should be aware of?
Of course, some common complications are bleeding into the joints, and easy bruising when you from little injuries, nosebleed. Yeah, that can cause joint damage too, neck bleeding, even brain bleed. Worst scenario. So all common in hemophilia.
So, if I am diagnosed with hemophilia, how would we go about treating it?
Yeah, there are treatment options for hemophilia. The main treatment is replacing the deficient factors, and we use the replacement therapy with desmopressin or antifibrinolytic drugs.
Okay. Will I be at risk for bleeding during my pregnancy?
Not necessarily, because during pregnancy, the pregnancy is a hypercoagulable state. That means the pregnancy situation makes a lot of hormones that protects you from bleeding. So you're not really at risk of bleeding throughout your pregnancy.
So, if I am diagnosed with hemophilia, what are the chances my baby might have hemophilia?
Um,
What would we do?
the chances that your baby might have hemophilia or risk of bleeding during your pregnancy. Okay. Um, if it comes that that your baby will have hemophilia, then we'll have to test the cord blood of your baby at birth, and then make sure that the baby determine if the baby has hemophilia or not. Then, if the baby has hemophilia, we have to start by preventing situations that can cause bleeding, um, especially that initial time we are going to give vitamin K. We will avoid giving vitamin K through the muscle. We're going to give it orally for the baby.
Are there some
To
signs?
avoid bleeding into the muscles. That's why we do it.
Are there some signs and symptoms we should watch out for the baby?
In the baby, yeah, you can watch out for bleeding in the gums, easy bruising. Watch the skin for easy bruising. Watch out the gums if the baby is bleeding through the gums, and you know, injuries that can bleed longer than normals.
Okay. Well, I thank you for answering all my questions.
All right.